Super parent, simply put, is somebody who is trying to do everything and to do everything perfectly. First and foremost, to be a perfect parent, but also a great spouse, good employee, clean house, fit body, and a smile on your face. It puts a tremendous amount of pressure on parents because it sets up a really high standard, and also comes with this belief that if you study enough, if you prepare enough, if you read enough, you will have the tools you need to succeed. But in reality, a lot of parenting, every infant is different, and you have to learn a lot through practice. So when things don't go as planned, when things don't go as smoothly as everything you've read, when you are tired and frustrated and don't have a smile on your face and feel like you're not balancing work and family very well, you really feel that you have lost control, that you're a failure, you feel a lot of guilt, that you're not being a good parent, and the tendency to really internalize those concerns and beliefs that you're not a good parent. Past research has focused a lot more on psychosocial risk factors, which are really important and have pointed to previous mental health history, marital distress, for example, low income, and that is an important line of research. But in my research, I was able to give parents the time to tell me their whole stories in open-ended questions, and to really get at a lot of other stressors that we've missed in standardized survey designs, and let them tell me, again in their words, what was going on, and to also include fathers, and to remember that fathers can also experience mental health struggles during, after, or before and after a child is born. Fathers can also experience depression and anxiety at this time, and they are also trying to balance work and family, and are increasingly involved and hands-on in taking care of their children, and now experiencing many of the stressors mothers have for decades. Also doing the midnight feedings and trying to soothe their babies, and feeling lost in the process, and also oftentimes ignored by doctors and parenting educators who are not really acknowledging and supporting their hands-on fathering role. We need to reduce the pressure that parents are perfect and be more realistic about these difficulties. And many of my parents said that you have to try not to over-prepare, because they felt like that set them up for failure. And to accept that you're going to learn a lot of parenting through practice, and that you have to be willing to accept help from others and not believe that you can do this all on your own. And so be prepared to be unprepared is what they say. And then when you are struggling, if you are having a hard time, don't be afraid to ask for help. And be willing to make time for yourself, so you don't have to sacrifice yourself and your own needs to take care of yourself for your mental health.